topic we are going to see is types of bariatric surgery. Nowadays everybody knows about the bariatric surgeries because nowadays it's become very common. It is done for morbidly obese patients or patients with severe obesity who is suffering because of the obesity some diseases. Bariatric is a Greek term, literally means obesity, so it's like obesity surgery. This surgery is not like our liposuction. Liposuction is for cosmetic surgery. It's only for shape. So bariatric surgery reduces the weight as well as it cures certain diseases. Normally when you have a food, the food goes through a food pipe and reaches the stomach. The stomach capacity is usually 2 to 2.5 liters. But for morbidly obese patients, it could be 4 to 5 times more. So if they have to eat that much of food to get that fullness or satisfaction. In bariatric surgery, literally we reduce the stomach size. So it can be broadly classified into two types. One is restrictive surgeries, the other one is restriction plus mal-absorption. Restriction, what we mean is we restrict the quantity of food. Yeah, the simplest one is nowadays most of the people would have heard about intragastric balloon. Intragastric balloon is nothing but through endoscopically a balloon is introduced which can be inflated with water and air to 750 ml. So always there is a balloon having 750 ml of water inside. So this naturally gives a feeling of fullness. Always you are satisfied with, your appetite will come down, and even with a small amount of food you feel full. So naturally over a period of time, maybe 6 months, you can reduce 10 to 15 kgs. The only thing is this balloon can be kept only for 6 to 9 months, depends upon the type of balloon and type of patient. So it has to be, if you want more, then again another balloon has to be put. The second restrictive is laparoscopic gastric banding. Here a thick band is put around the stomach, restricting the quantity of the stomach capacity. So with less food again, the calories intake is very low. So over a period of time, they can lose weight up to 40% of their weight. The band can be adjusted. It can be tightened more or it can be loosened according to their needs. The third is laparoscopic sleeve gastrectomy. So here we remove vertically, remove 2/3 of the stomach. The expanding portion we call, the larger portion of the stomach has been cut and removed. So now the stomach will be like a foot pipe, almost like a tube, like a sleeve. Foot pipe, stomach, all like a single tubular structure. So here also restriction of food. So calorie intake is very low. So over a period of time, they can lose weight. Up to 40-45% of the weight can be reduced. The other types we call restriction plus mal-absorption. In the first one comes is the gastric bypass. Probably you heard about cardiac bypass, heart bypass surgery, wherein we bypass a blocked artery, a blood vessel. We bypass this block. The same way here the food is the stomach is bypassed. The food bypasses the stomach and goes directly to the small intestine. In that way, the stomach can hold only little amount of food and it bypasses the major part of the stomach and goes to the small intestine. So the actual absorption or digestion happens only in the small intestine. So restriction of food and mal-absorption. This is the gold standard of all bariatric surgeries done because the time tested one. There are 10-15 types of bariatric surgeries, of which this is the gold standard. And more than this, there are other surgeries like mini gastric bypass or duodenal switch, bariatric diversion, metabolic surgery kind of, but done for diabetes, all these things. But most of these things are all, especially the duodenal switch and other things are for people who have more than 200 kg, Generally, I feel that is not suitable for our Indian patients. So these are the classifications and types of bariatric surgery. Usually the bariatric surgery is not for everyone. It's done mainly for people BMI, body mass index is more than 35 or 40, or for Indian standard is 32 plus any comorbid conditions. So again, this bariatric surgery is not a cosmetic surgery like liposuction. Liposuction is only a cosmetic surgery that will only to reduce the shape, not weight. And liposuction cannot modify the diseases, but bariatric surgery can modify or in fact completely cure the diseases.